so you guys can see the time. 5:56. You guys ever just look at your calendar on a Sunday night and just look at all the things that you have to do? And I'll put my calendar, a screenshot of my iPad calendar on the screen here, although I don't think I'll do it justice, but you just know you have a hectic and heavy week coming up. Well, that was me yesterday, and I want to bring you guys along with me for the week and show you guys what it's like to have a nice, long, productive week in medical school. So without further ado, let's get into it. This is a week in the life of medical school. All right, so it is now 8:30 a.m. I just finished up my Anki reviews for the day. I like to try to get them done a little bit earlier. I'm actually starting my weeks and my days a lot earlier now. I want to switch things up. I was studying a lot later in the night, and I just prefer to wake up early at this point, get done a little bit earlier in my day so I can have my evenings to kind of chill and relax. Just to give you guys a little insight about where I am and where we are in the curriculum right now at my med school. We're in block 2, and in this block we have 6 weeks worth of content. Out of those 6 weeks, we're in week 5 right now, so we're second to last week of content, so almost wrapping up and getting ready to gear up towards exam time, which is always a little bit more stress inducing, but overall everything is super good. I'm actually about to go into and do a practice midterm that my school has given us, just to kind of see and assess where we are based on the first half of the content. So I'm about to get into that right now, then get some breakfast and continue on with the rest of the day and get these lectures in. All right, so it is 2 o'clock right now, and I just got done with an orientation for a health mentors program that my school has. Basically what it is you have students from 10 different professional schools, whether that's athletic training, PT, OT, PA, nursing, medical students, and we all come together and we're put into different groups and we talk about how we can serve healthcare and from our respective fields. And if you know me, if you've seen videos on my channel, if you've seen the interviews that I've done, that's really all that I'm about. I'm all about collaboration. I'm all about how we can work together to make healthcare better. So it's something that I'm looking forward to getting involved with. We actually have a patient with a chronic illness that we are interviewing, and we get to know how from each of our respective fields we can work together and help their condition or help somebody with their condition in the future. So my patient that we're working with has a spinal cord injury, and I'm looking forward to getting to know them more and getting to know more about how different fields of medicine can help that injury and help that disease. So just finishing up that now, and it's 2 o'clock and I still have to get through 3 lectures. So we have a lot of work to do. I think I'm actually gonna head to campus so I can kind of zone in. Hopefully it's not too late of a day, but yeah, still have to get through those lectures, and it's 2 o'clock. So we'll see you at the next clip. What's going on, guys? So it is Tuesday, about 2 o'clock right now. My morning was pretty much a lot similar to yesterday, other than I had case-based learning. For those of you guys that don't know, case-based learning is essentially where you meet with a small group of your classmates and you go through a case. And then Thursday, we're gonna come back and actually figure out what the ending of the case was and just do a little bit of presentations. But that's pretty much my Tuesdays and Thursdays. Right now, I'm actually getting ready to do clinical skills. That's why I'm in my white coat. Clinical skills right now, we're still not able to do it in person with actual patients because of COVID in Philly right now. But overall, we still get to do patient interviews and different things like that over Zoom. So I have that set up right now in about 15 minutes with a standardized patient. Then I have to actually go to campus, and we're gonna do it on a physical exam of the lymph nodes on models, basically like the dummy models that they have there, just to give us some practice. We did that already, but this is kind of gonna be a second go around, I guess, a second practice. So I'll check in with you guys after that and let you guys know how that goes. Off to campus, how we looking? Let's go. What's going on, guys? So I just want to give you a quick update. Clinical skills went well. it's nice to just get more practice and get more comfortable with doing history taking and coming up with a diagnosis and a differential. I think just practice makes perfect with that kind of stuff. I was able to go in and learn more about lymph nodes, palpating the spleen, percussing the spleen to kind of ascertain for different lymphadenopathies and splenomegaly and different diseases like that, infectious diseases or maybe even cancers, lymphomas of those organs. So practice makes perfect, and I think that just getting more comfortable with it will be better. We have our clinical skills exam on that exact stuff, so just more practice makes it a lot easier. I'm about to head in the last thing I have for today. Right now, it's actually starting right now, so I have to hurry up. But it is a race and medicine humanities course, so we actually have to do two humanities courses for our first 2 years curriculum. And the first one that I am doing is a race and medicine one. So we talk about different things regarding race and medicine and how we can kind of improve our biases, improve the things that we think about, improve how we view medicine from a racial perspective to improve going forward. So it's an interesting discussion. It's kind of just like a calm discussion for 2 hours, and then that's pretty much it for the mandatory things, and then we're just studying for a little bit for the rest of the night. But I'll probably catch you guys tomorrow. I think this is gonna be the last clip for today, and tomorrow's Wednesday, so we're halfway through the week, so let's get it. All right, so it is Wednesday, about 6:45 a.m. right now. About to get started on these Anki reviews. Long day today. I'll be honest, long day today. We have 5 hours worth of lecture content to get through. I'm still very shaky, still on Monday's stuff. So learning that plus learning new material on top of it, this is where it gets to that, drinking water out of a fire hydrant analogy. And it can be tough to deal with sometimes, can be tough to push through, but just gotta attack the task at hand. I have a whole list of things I wanna get through today, so we're gonna just attack one at a time, starting with these Anki cards, and I'll check in with you guys later. So let's get to it. So medical students, we still have to do regular things like laundry. So this is my laundry Pomodoro technique study. While the laundry is being done, then change it as your break, and then put it in the dryer, go back to studying, rinse and repeat. What's going on, guys? So it is about 8:50 right now, and wrapping up for the day. I think I'm pretty much content with everything that I did today. Just finished wrapping up my CBL presentation actually. So I mentioned to you guys, I think yesterday, how on Tuesdays we go through the case, and then on Thursdays we come back and we do some presentations. So I just finished up making my presentation for the week and pretty exhausted if you guys cannot tell, but we're about to get after it again tomorrow. Thursday, we're almost done with the week. Friday, we have a quiz coming up. So Thursday, tomorrow, probably gonna do a lot of preparation, studying, kind of trying to solidify a lot of the loose ends and kind of wrap up here. But that's the end for Wednesday. See you guys tomorrow, Thursday, 4th day, almost done with this week. Catch you guys then. What's going on, guys? So it is Thursday morning, about 8 o'clock right now. About to head on the road to head to campus and get some studying in. I've been up since about 5:15 this morning studying, and was luckily able to get all my Anki done. Now we're just kind of zoning in, trying to catch up this week, hopefully learning as much as possible in the next 2 hours before my CBL. Then we're gonna have CBL. I'm actually meeting up with a friend later from college, from one of our volunteer programs. I met him, and we're meeting up to get some sushi. He's in Philly for the week, so it should be interesting to get to actually talk to somebody outside of my classmates for a change, and just to catch up with him. Should be a good time and a good day, hopefully. Just finishing off the last 2 legs of the week and getting after it. So I'll catch up with you guys in a bit. What's going on, guys? So happy Friday. It's about 5:25 a.m. right now. I'm sorry and I apologize. I did not record a lot yesterday. It was just super hectic. What my typical Thursdays are like is pretty much, they're pretty busy because I have a lot of extra stuff packed in. So on Thursdays, we pretty much are gearing up for our quizzes on Fridays. And for the quizzes on Fridays, we're given a bunch of learning objectives on Thursday, and basically what my CBL group does is we split it up Each person gets one or two or three depending on the week and how many learning objectives we have, and then we have to fill them out. And then a few of my group members, we have a review session over Zoom at night to kind of prep for the quiz and kind of review for the week. The quizzes don't count for anything, they don't count towards our grade, but it's just kind of like a accountability thing that we have going on pretty much, where we just meet every week and we review and we kind of see what we know and we don't know. So that's what I'm doing today. I have my quiz at 9 a.m. So for the next few hours, I'm just going to be grinding, trying to get as much knowledge in as possible, not to kind of get a good grade because I don't really care about the grade because it doesn't count, but to kind of catch up. So I'm gonna get after it right now and hopefully have a nice productive, looks like 2.5 hours before my quiz. And then after that, I think I have a few lectures, and yeah, it should be a good time. Let's get after it. All right, so quiz is complete. Review of the quiz complete. It's about 10 o'clock right now. Overall, the quiz wasn't awful. I think that going into it, I felt a lot more confident after studying this morning, so that was good. But I still have to do a lot of review this weekend just to solidify stuff. I don't feel super confident with the stuff right now, and I definitely want to feel better for my block exam coming up in a couple weeks. Right now, I'm actually going to go to CVS to get my flu shot, just walk around a little bit, get outside. I've been stuck inside for so long, so I just want to kind of get outside and enjoy this nice day. So let's go. All right, so it is now about 7 o'clock. Let me double check. Yeah, so it's 7 o'clock right now, and today's pretty much over. This was the week in the life of a productive week in the life of a medical student. Today, the rest of the day, after I got those delicious donuts, I pretty much just came back, watched a few lectures that I had to watch, and then pretty much chilled. Fridays, I'm usually very, very beat from the week, and I usually just try to take it easy for the rest of the Fridays. So I'm just gonna enjoy the rest of tonight. I actually had a virtual happy hour with an Ortho Society here at my medical school, and I was fortunate enough to be elected an executive board position as a first year liaison. So it was really nice just to get to learn more about the club, meet more of the executive board members and other members of the club, and to just be around different people with similar interests to you. I'm interested in orthopedic surgery, so it was nice just to get mentorship and ask questions to upper years that are kind of going through it and can relate to what I've gone through or what I'm going through right now as a first year. So that was the rest of my night. Right now I'm just going to eat some dinner, enjoy the rest of my night, and then get after it tomorrow. Last but not least, if you enjoyed the video, thank you so much for watching. If you think I should do more vlogs and different things like this, if you like this perspective, just leave a comment down below and let me know what you want to see. If you're new, make sure you subscribe to my YouTube channel. I'll be putting out weekly videos just like this and other content about medical school and pre-med journey. And if you like the video, make sure you like this video. Good luck to everybody out there, and let's get it.